Welcome to Global Health Council's 2017 Landscape Symposium. Give yourselves a round of applause for being here at 9 a.m. on Friday.
We've reached a crossroads where the decisions we make now will determine whether or not we reach our 2030 goals and ultimately create a healthier world.
All of this group is ready for some hard work, because I don't know anybody that works in the global health space that isn't up for a difficult task.
You know, I grew up learning about preventing low birth weight as, you know, investing in maternal child health interventions or better nutrition. But it was fascinating to read, to learn how air pollution is now contributing to low birth weight and cognitive, growth of the child. I thought it was a fantastic connection where it means that I need to invest in the basics, but I need to invest in emerging disease and draw the connections as well. So it's more than funding, as I see it. It's about a strategy, designing interesting programs, innovative programs. How do you leverage resources so you can maximize through better program designs?
I think the other piece is also staying ahead of the public opinion curve, which continues to surprise me in this country, where half of Americans in this country think that we spend 30% of the federal budget on foreign aid, when we know that in fact we spend less than 1%. We spend about 0.22% of the entire $4 trillion federal budget on foreign aid in global health efforts. And the average American thinks that we spend 30% of our budget. So there's an incredible disconnect there. And I think we also need to do a better job telling the story, Raj, to the American public of the importance of global health efforts.
I agree with Bill in terms of needing to set targets, needing to be clear about what we're trying to achieve, measuring that, and showing results. And I would challenge all of us to say that's what will get global health more resources, is more results that demonstrate the link to national security and bring America is first because we're helping everybody get to their best first. So I would challenge us to really think about what Bill was talking about, Parv was talking about. How do we put innovation to work? How do we break down our silos? How do we provide global health in the world that we're living in? I think it's about really focusing on the people we're serving. I think if we focus too much on what the donors want or on the money that's coming in the door, you almost miss the point, right? Because we're not necessarily serving the people who are out there. And if you serve people, I'm going to go back, if you serve people well, you're going to end up with the resources and you're going to end up with funding from the donors. But I think we need to embrace disruption and transition. And that's transitioning ourselves, our NGOs, how we think, and embracing all the partners that are coming in.
She's a champion of human rights, and I'm proud to say she's also my personal inspiration. Please join me in welcoming Her Excellency, Dr. Joyce Banda.
I'm very grateful forever for the US government for what they have done for me. I've always said that I'm a product of USAID, because it's possible for you to be that determined, have that zeal, want to do something about the situation, but if nobody reaches out and pulls you out and give you the support you require, you can't do it. What I'm saying is that Africa is not poor. It is us who have to stick it here to realize that we have so much resource on the continent. We have to engage the people that we serve. I believe that leadership is a love affair. You must fall in love with the people, and the people must fall in love with you. And if you love your people, you shall engage them and talk to them and tell them the situation, no matter how bad. And what I have learned during my years as a leader is that when you explain to the people the situation, they will understand and stand by you. But we must not be talking separately. We must be talking together and forging programs together and forging smart partnerships.
Please join me in applause for this.